He's at his desk. He's slumped over. I come in, and Chad already knows me, so I don't have to introduce myself. Hey, Chad, what's going on?
Just a lot of heavy pressure in my chest.
You have pressure in your chest? How long has this been going on?
Maybe 5 or 10 minutes.
5 or 10 minutes. Okay, that's not too bad. Does the pain go anywhere?
It's kind of shooting down my left arm.
It goes down the left arm. When somebody's having a heart attack, they'll typically note that they have pressure in the chest. The pain may be localized there, or it might radiate down the shoulders, sometimes up through the jaw and the back. And in fact, females that are having heart attacks will usually not have pain necessarily located in the chest, but they'll have it in the low back, the upper back, and out through the jaw. And they'll also be very fatigued as well. So what's happening here is, in Chad, his heart is not working as strong as it can. Some of the vessels are possibly being clogged with a cholesterol buildup. And so what we need to do is a couple of things. We may have to put Chad down on the ground and put him into shock position. We may need to elevate his legs. We want to call 911. Calling 911 is very important because they're going to have all the necessary equipment to take care of him, give him oxygen. Also, if Chad's having a heart attack, he may be on medication. Typically people that have what's called angina, that is, they have a buildup of cholesterol in their coronary arteries, and they take a medication called nitroglycerin. Nitroglycerin will dilate the vessels and help them breathe and feel better. So I want to ask Chad if he's on any medication. Are you on any medication for this? Nope, he's not on any medication. It's very important that if somebody is on nitroglycerin or on a medication for their heart, that you do not give Chad their medication. That is a prescription medicine, and it is designed for the person that it is prescribed to. So the only thing we can do is make Chad comfortable and call 911. If Chad tells us not to call 911, recommendation is to call 911 anyway. And then what we're going to do is maybe put Chad down on the floor. I'm going to go ahead and bring him down on the floor. So I'm going to just bring you down, push this chair out of the way here, and I'm going to have you lay down. Now, if Chad doesn't want to lay down, we don't want to cause any more anxiety. If he wants to sit down, sit up against the wall, that's fine. We don't have to raise his legs as long as he's sitting down. We want to get him as close to the floor as possible. Now, if your company has what's called an automated external defibrillator, it's a good idea to get that. In this device, if Chad's heart was to stop, that is, he'd go into cardiac arrest, we would need to, 1, start CPR, which is cardiopulmonary resuscitation, where we would do chest compressions and ventilations. And number 2, we would need to shock Chad early on. That is, apply this automated external defibrillator, where we would open it up, turn it on, apply the pads to Chad's chest. This will actually analyze his heart for us and let us know if he needs a defibrillation shock. But in this case, we're just going to get it for the standby here. We're going to stand by Chad here. We're going to call 911 and send somebody out to meet with emergency medical personnel. We're going to keep monitoring Chad, and if he gets worse, then we're going to provide that level of care that he needs. Now let's talk about fainting and seizures. Some people faint because they may be down low and they get up and the blood pressure drops and they get a little bit lightheaded and go down to the ground. If you see somebody faint, it's not necessarily a medical emergency. You want to go over there, ask them what happened, and provide level of care. Just kind of tell them what's going on, ask them what happened, and if they have to, lay down until the blood circulation returns. And then as long as it doesn't happen again, it's not typically a medical emergency. But somebody that faints over and over again, especially 10, 15 minutes apart, that's something that you may want to call 911 or seek medical attention. Another problem is seizures, though. Seizures can happen from a whole variety of things. Epilepsy, of course, is the most common thing. But seizures also can arise from people that are hot, allergic reactions. They might be drinking too much coffee. So seizures is kind of a generic term in that the ABCs of the human body says a seizure is like a storm of electrical activity in the brain, and that the person might shake or convulse a little bit. They might go down to the ground and pass out momentarily. The most important thing that you can do in a seizure is recognize that a person is having a seizure and move things out of their way. Typically, people don't get injured from seizures unless they hit something on their way down or as they're going through their seizure. So their body may be convulsing or moving or wiggling as fast as you've ever seen, and you just want to keep things out of their way. Now, if you know how somebody's having a seizure and it's not really bad where they're moving their arms around, you might be able to hold their head, try to cup their head to make sure that they're not going to get injured in this seizure. Now, typically, state requirements or state laws say that if somebody has seizures, they have a medical alert bracelet, they're a known seizure patient, and they have these seizures, it's not a big deal. You don't need to call 911. We typically look at, we'll call 911 if somebody's never had a seizure before, it's their first one, or if the seizure lasts longer than 5 minutes. So if somebody's having a seizure and it's 4 minutes and 30 seconds, you want to think about calling 911 because it's a long time. Because during that seizure, because they're moving around so fast, they're not really breathing that well, and so you want to make sure that 911 calls because they might need that extra level of care to help them with their respiratory problems after the seizure. So, in talking with Chad here, and Chad and I are just talking back and forth, sometimes a person that has seizures, and we know that Chad has seizures all the time, he may have a premonition that something's happening. Sometimes they even give off a metallic smell. Sometimes we even see animals with seizure patients where a dog might be here and recognize that Chad is giving off this metallic smell and bark to alert us what's going on. So as Chad and I are talking, he starts to have this premonition here, and so I can say to Chad, it looks like he's starting to get ill here, and I'll say, what's going on, Chad?
I think I might have a seizure.
Okay, I'm going to help him down to the ground right away, so I'm going to move things out of the way here, and so Chad is starting to move around, and so as I can see, he's moving around, and I'm going to go ahead and support his head. Now this may not go on too long. This could be 10 or 15 seconds, or like I said, even 5 minutes. As he starts to relax here, he's coming out of his seizure. So it looks like his seizure is almost over here. And so it didn't last more than 5 minutes. We don't really need to call 911. But what I am going to do is support his respiratory need here. Because he's laying on his back, it might be difficult for him to breathe in that his muscles are now in a very relaxed state, also known as the post-ictal state. So in this post-ictal state here, I want to roll Chad onto his side or the recovery position. He's not injured himself in this seizure here, so I don't need to administer first aid there. But what I am going to do is move him onto his side. In rolling somebody on their side to help them breathe, the first thing you want to do is take the inside leg here and move it up nice and high like this. And then what I'm going to do is I'm going to move this arm above his head. I'm going to take this arm over and I'm going to cup this around his head. And then what I'm going to do in rolling Chad on his side here, and it doesn't matter which side you roll him on, I'm going to grab his leg and his arm and I'm going to pull him over onto his side. That leg will come down and support him. And in this case, I can support him. I can watch and see how he's breathing, and I'm right here and I can tell if he's breathing or if he's having difficulty breathing. And then eventually Chad should recover. As he recovers, the only thing he'll need is rest. People have taken up to 3 days of rest after major seizures, seizures that go on for several minutes. Another thing that we note with seizures as well is something called incontinence. That is, when somebody has a seizure, we may see bowel movements or pee, and people may pee or poop their pants. It's called the fight or flight scenario, and so in that case, it can be embarrassing for some people in a public area. So if you're in a public area and you're providing first aid care for somebody that's had a seizure, take care to note that and help that person out with other people that might be there watching. Sometimes crowd control can go a long way in taking care of your patient. Now let's talk about diabetic emergencies. Diabetes is one of the fastest growing diseases in this country. Sometimes people produce insulin, but the insulin doesn't work well in their body. It doesn't break down the sugar. And sometimes people don't produce enough, and then sometimes they produce too much. In diabetic emergencies, there's kind of a balance between insulin and blood sugar, where some people have blood sugar that's too high or too low. In recognizing diabetic emergencies, we can look for medical alert bracelets, and of course, if you're a diabetic, you want to let people know around you that you have diabetes. sometimes people will actually have what's called insulin. This is medication that they'll inject. Again, you need to check with your local and state laws if you're going to help somebody administer this medication here. So typically what happens is people that are hypoglycemic or their blood sugar is low, they'll be very lethargic, they'll be weak, they'll they can have a bad attitude. They can actually say things that they ordinarily would not say. They can get kind of mean and nasty, and that can be somebody that has low blood sugar level. And in this case, it's simple enough that we can just give them sugar. Now, when you're giving sugar to a diabetic that is hypoglycemic or has low blood sugar, it is important to give just plain sugar. That is orange juice or mixed sugar, or there's even a medication called glucagon that you can get and give to people, or they might have that on their person. Okay? People that are hyperglycemic, that have high blood sugar levels, will typically have a very fruity smelling breath. They'll be very thirsty. They won't be able to quench their thirst. These are typically people that have eaten a large meal. They've come back from lunch and they've got all these conditions, and they haven't taken their insulin, or their body again is not using the insulin that it's produced here. So Chad's just come back from lunch here, and so I see that he's in this chair here, and he's kind of got an altered level of consciousness. He's chugging this water down here, and I'm going to go up and interview him and say, "Hey, Chad, what's going on, buddy?"
I'm really thirsty and I can't get enough water. I just keep drinking water.
He keeps drinking a lot of water. Are you a diabetic, Chad?
Yeah.
I knew it. Okay, so and are you on any medication?
Yes.
Okay, he is. And what kind of medication are you on?
Insulin?
Insulin. All right, so in this case, if Chad is on insulin and if he is not so weak that he can take his own insulin, I'll go ahead and get that medication for him. So I can give him that medication, I can help him to the point where he can administer it himself. Again, you want to make sure that you have the ability to administer it in the know-how should Chad need that medication. If you're ever in doubt, you'll want to call 911 and they'll be able to help you out with this. So in this case, Chad is drinking a lot of water. Now, even if people are hyperglycemic, that is, the blood sugar is too low, typical local laws and regulations state to still give somebody sugar. Even though the blood sugar is still high, we give sugar because some people can't make the determination between hyperglycemic and hypoglycemic, or high blood sugar and low blood sugar. So the typical first aid treatment for a diabetic, whether they're thirsty, have an altered level of consciousness, or very weak and are saying things that they wouldn't normally say, is that we treat them with sugar. We'll call 911, we'll take orange juice, add a packet of sugar to it, mix it up, a high sugar drink, and then allow them to drink that as long as they can. Make sure that the level of consciousness allows them to drink that. And in that case, you've taken care of them should their blood sugar be low. If it's too high, higher is not going to make the situation worse. Now let's talk about hypothermia. A lot of people feel that when they're in areas where there's a lot of sun and it's very warm, that hypothermia is not likely. But in fact, hypothermia is very common in areas like California or Florida where it's typically warm. And that's because people don't typically will dress up, they won't dress warm when they go out into the environment. And water is also another thing that a lot of people will be swimming in water or diving, and they can become hypothermic very easily. Your typical temperature, your body temperature, is 98.6. It only takes a 3-degree drop in temperature for you to become hypothermic. So Chad here has been hiking out in the mountains here, and we've come across him and we notice that he's shivering. Now the first stage when somebody's starting to go into a hypothermic state here is they're going to be shivering. That is, the muscles are rubbing back and forth together and try to warm you. So that's what we're going to see. Once somebody goes into a true hypothermic state, they will stop shaking, they will stop thinking or concentrating. They'll have what's called an altered level of consciousness, and then they can pass out and die. So this is a true life-threatening emergency. So when we come up to somebody and we ask them, what happened here? What have you been doing? He's very, very cold. So he's been out, he's been hiking in the mountains. It's a pretty cool day here. So the best thing I can do is re-warm Chad here, whether we do it with warm fluids, water bottles, or anything. So the first aid I'm going to do is warm him up. And I'm going to put as many blankets around him as possible. Sometimes you can get what's called hot packs. There's cold packs and hot packs. These are chemical packs that all you have to do is break them and they'll get hot. And we'll show you those in a few moments. But in treating Chad for hypothermia, if he's shaking and I'm able to warm him up, I may not need to call 911. I can put him in the shock position and elevate his feet. But if he's more comfortable sitting up, that's what I'm going to do. I'm going to give him warm fluids. I'm going to warm him up as soon as possible. Now, if Chad has passed that stage of shaking and he's not shaking anymore and he has a very blank look on his face, as you can see that his face is white and he's not really moving, then this is a true life-threatening emergency. In this case, I'm going to warm him, but I'm also going to put him in the shock position where we're going to lay him down like this. We're going to, again, elevate the feet anywhere from 10 to 16 inches. We're going to cover him up as much as possible, make him as warm as possible, and support his breathing, making sure that he's breathing. The most important thing that we do here is contact 911. Now, in some cases where some people are hypothermic and they've been out in the cold, they can actually get what's called frostbite. In frostbite, what happens is the vessels or the blood inside the body starts to freeze. And when it starts to freeze, circulation diminishes. We typically see this at points like the fingers, the toes, and the nose. And what happens in exaggerated cases is that the circulation is so poor in the fingers because the blood vessels crystallize that there's no blood getting there, and you'll actually see fingers and toes and noses and ears actually turn black. That's kind of a stage of gangrene. In this case, we may not re-warm this person. If you're out in a very cold environment and you note that somebody has hypothermia, you want to warm them up. But if you see frostbite on the fingers and the toes, and you're not out of danger yet, you may not want to rewarm this, in that if you rewarm these affected areas and you warm them up and the blood starts circulating again and you have to go back out into the cold, they're going to refreeze and make the situation worse. So if Chad and I need to get off this mountain and I note that his fingers are dark or blue or black on the ends there, maybe his toes, maybe his nose, and we're still on this mountain, I'm not going to rewarm him, in that I'm going to assist him as best as possible in getting him off the mountain or out of harm's way. If I know that he's going to be in an environment he's going to be able to stay warm, then I'll start the rewarming process. When you're rewarming somebody that has hypothermia or frostbite, again, you want to use towels, you want to use blankets, and you can use hot packs. In the case where somebody has true hypothermia, they may not be able to have any drinks, in that their level of consciousness is so low that if they were attempting to drink hot fluids, they might just spill it on themselves. So you'll have to do the warming process for them, and again, call 911. Let's talk about burns. There are different types of burns, typically first, second, third, or partial thickness and full thickness burns. Now, burns can come from, say, sunburn, or people that get boiling water spilt on them, or even chemical burns. And the way you treat them can be different. Typical first-degree burns or sunburns can be treated with cooling water, aloe vera, and solar cane. A second-degree burn can happen from a first-degree burn, and that is you'll start to see blistering on the area. It is important that if you find that there's blisters due to a burn, whether it be from hot water or from a sunburn, that you don't pop the blisters. In treating burns, you want to cover them up. The burn is actually damaging the skin. The skin is the largest organ of the body, and the purpose of the skin is to protect the body from bacteria from the outside. So anytime you have a burn, you're damaging that layer of protection. And so it is important to note that if somebody has a second degree or even third degree burn, that you treat them by covering it up and maybe seeking medical attention here. So we're talking to Chad here today, and Chad's been burned. He's working in a lab today, and he's got a chemical that's spilt on him. In treating chemical burns, there's two ways. There's two general ways to treat this. First of all, if we need guidance on how to take care of this burn, we can use a document called MSDS, which is Material safety data sheet. In a workplace environment, MSDSs are a document that tells you how to treat or provide first aid and the level of care for every chemical that you have in your workplace. So you can certainly always consult that. Second, and generically, if Chad has been burned by, let's say, a liquid, we can always use water to rinse off that liquid. But if he has a dry chemical on his leg or his arm, you never want to use water to clear that off. Because if Chad has a dry chemical on his leg or on his arm or his shirt or his face, and we use water to rinse that off, the water is going to liquefy that chemical and cause an absorption hazard. So the way you treat dry chemical burns is that you want to brush them off with a rag or a brush. And once you get it all off, then you may be able to rinse it. It's not uncommon to rinse something, a burn like this, for 20 to 30 minutes. The important point is you don't want to use water that's too cold. And using too much cold water on a burned area, you can actually cool this person down and actually put them into a hypothermic state. So in this case, where Chad's got this burn here from this chemical, we've rinsed off the chemical here, we've consulted the MSDS, and it's told us to go ahead and wrap this up and then keep an eye on it. We see that it's probably just a first-degree burn in that there are no blisters. So in a first-degree burn, it's just going to be a redness and tenderness of the skin there. In a second degree, we would start to see blistering around the area, and again, you don't want to pop those blisters. In a third-degree burn, typically from an electrical burn, say somebody was electrocuted, we'll see that it is black and charred in that area. In that case, you also want to wrap it up and definitely call 911. So in this case with Chad here, I've cooled down that burn with some water. I've taken some cool rags and I've cooled this down, and I've even put a little cool water on there. But when I go to wrap this up, I don't need any types of ointments or oils or anything to help this burn here. All I need to do is provide another layer of protection for the skin. So anytime you're wrapping up a scrape or an abrasion or a burn, all you really need to do is cover it up with a clean cloth or gauze pad and then wrap that up and then watch that and make sure that it doesn't blister. So what I'm going to do is I'm going to lay some gauze pad over his burn here, and I'm going to take some roller gauze and I'm going to start at the end of his arm here, thank you, and I'm going to roll this around. Now anytime that you're wrapping somebody up, whether they have a burn or cut, when you wrap them with roller gauze, you want to overlap it about 50% of the existing bandage. That is, as I'm rolling this bandage up and down, I'm going to cover the existing bandage 50% of the way. Some bandages actually have dotted lines that go down the center and assist you in doing that. Now when you wrap this up, you don't need to make it tight. Take note that I'm only rolling this on his arm and that I'm not taking it and wrapping it tight. Because if you grab this roller gauze and wrap it really tight, you can actually cut circulation off to his hand here. So I'm going to make one pass up and then back down. Now when I get to the bottom of this and I've got all this leftover bandages, sometimes roller gauze will come with tape and pins and stuff like that, and you'll cut it and you'll pin it. You really don't need to use all of that. All you need to really do is take a couple of fingers, make a little bit of a gap, swing this roller gauze around, and then you can tuck it in there. And then in doing so, if we ever need to put more gauze on here, we can actually add some more, pull this back out, and use the leftover bandages. It doesn't have to look good, it just needs to protect the skin. And then of course, because I've wrapped this up, I want to make sure it's not too tight. We can actually do what's called capillary refill, like we did with Robert, and we can push in on the fingernails and see that blood is returning to his fingers within 2 seconds. That's a good capillary refill. Thank you. Go ahead and lay this down. Now, in a third-degree burn where there is an electrical burn, typically what happens is if somebody is electrocuted, they'll have a third-degree burn, which is a black charred area. In first and second-degree burns, there could be a lot of pain associated with this. In a third-degree burn, because it's a very deep level, the epidermis has been damaged, and there's actually the nerve endings have been damaged as well. So people may not have any pain with a third-degree burn, but they're very life-threatening. In